Hi, in today's lesson we will be looking at blood glucose regulation. In order to do this, we will describe the body's response to high and low blood glucose regulation. We will also compare type 1 and type 2 diabetes and how they can be treated. So why are we learning this? The biggest risk factor for type 2 diabetes is being overweight and obese. How do doctors judge whether you are obese? So first of all, what is diabetes? Diabetes is a disease where the concentration of glucose in the blood is not controlled properly by the body. It is either too high or too low. So what are the symptoms? The symptoms for diabetes vary. Some of these may include the need to urinate frequently, increased thirst and fluid intake, and an increased appetite. Confusion, unconsciousness, and even coma. Too much glucose, however, can cause exhaustion and blurred vision. Processed foods often contain a lot of sugar. This is absorbed easily in the digestive system, causing a rapid increase in the blood glucose level. So how do we control blood glucose level? The body goes through two different stages. But first of all, we're going to look at the amount of glucose in our blood is controlled by the hormone called insulin and glucagon working with the pancreas. So how does this happen? If we look at the diagrams below, one shows when the blood glucose concentration is too high and the next one shows blood glucose concentration when it is too low. First of all, we will focus on when the blood glucose concentration is too high. So what happens? Clearly, there is too much glucose in the body. The pancreas releases insulin. The insulin allows the glucose to be converted into insoluble liver glycogen. This allows the glucose to be removed from the blood, moving and changing the glucose blood levels to normal. When blood glucose concentration is too low, the pancreas releases a hormone called glucagon. This allows the insoluble liver glycogen to be converted into glucose. The glucose is then released into the blood, stabilizing and returning the glucose blood levels back to normal. We refer to this as negative feedback. So what is negative feedback? Negative feedback is a change in the body when it is detected and control mechanisms are used to return it back to the normal level. For example, the two examples that we have looked at when blood glucose levels are too high or too low. So let's look at some key words that you may need to know. First of all, insulin. What is insulin? Insulin is a hormone released when blood glucose levels are too high. The liver. This is an organ where excess glucose is stored as glycogen. Glycogen is how excess glucose is stored. And lastly, the pancreas. These monitor blood glucose levels and release hormones, such as insulin. So let's look at type 1 diabetes. This is when the pancreas produces no insulin. To treat this, we use insulin injections. No other treatment is available. Type 2 diabetes is where the cells don't respond to insulin. It is treated with a low sugar diet and exercise. To summarize, type 1 diabetes is where the pancreas don't produce enough insulin and it is treated with insulin injections. Type 2 diabetes is where insulin is produced but the cells no longer respond to it. It is treated with a low sugar diet. Obesity is a risk factor and it can also be treated with exercise. Another factor that may help is treating it with a low carbohydrate diet.